So this person reached out and said, I was diagnosed with congenital cervical stenosis with multiple bulging discs in my neck. It was about 2.5 years ago. I was a football player throughout college. I dealt with stingers going down my arm that caused concern. Come to find out, this was the issue causing it. Do you have more info on my condition, or can you explain it? So first of all, spinal stenosis is kind of a catch-all term. It means a narrowing of your spine, and it can be a narrowing centrally, so central stenosis, or narrowing on the periphery, so peripheral stenosis or lateral stenosis. And that closes down on the spinal nerves versus the spinal cord. Those cause different symptoms. Most of the time, you get pressure on the peripheral nerves. These are the nerves that get irritated during a burner or stinger. So what this is a forceful separation of your head and shoulders that commonly occur in football because of tackling and how you fall. What this is a traction injury to your brachial plexus, which is a group of nerves. So basically, you're pulling on your nerves. Nerves do not like to be pulled on. So when you pull on them too hard, too quick, you basically damage them, and you get pain, numbness, tingling, and weakness temporarily. But what happens is that when you stop pulling on them, they recover within a given amount of time. Most of the time, it's seconds to minutes, or at the very least within hours. But what happens is that if this happens over and over and over again, the nerves get more and more irritated and more easily irritated. And additionally, after these nerves get irritated, nobody does the right treatment for it. They'll do stretching for this, and you shouldn't stretch because that's what caused the nerves to get injured in the first place. You actually want to treat the nerve at the spinal root, at the nerve root, and that's by moving your spine in directions to take pressure off the nerve. Also, finally, for this person, if you have stenosis, and even if you're getting diagnosed with congenital stenosis, which I don't necessarily agree with later in life, this is very, very treatable. These symptoms that come from this are very treatable without medications, without injections, and absolutely without surgery. If you have the right treatment, you will recover from this and be completely symptom-free despite still having the findings on the imaging.